I think I'm audible for everyone. Please let me know whether I'm audible or not. Please let me know whether I'm audible or not. Am I audible for everyone? Am I visible as well? Please let me know. Okay. So, sir, can't listen your voice. Someone is writing, sir, can't listen your voice. But people are writing, yes, sir, yes, sir. So what's... So just let me know that whether I'm audible or not. So yeah, yes, sir. So yes, sir means I'm audible to everyone. Okay. So I think I can start today's session right now. Okay. All right. So welcome you all in this session. Okay. Just let me confirm once again. Okay, all right. Can you see the screen? Can you see the screen nicely? I think yes. Okay. So should I move to the first question? Question number 1. Question of today's topic is on locomotion and movement, and we are heading towards the first question of the day. Which of the following is a structural protein of the muscle cell? Okay, options are in front of you. Option A, actin. Option B, dystrophin. Option C, troponin. Option D, tropomyosin. Okay, these are 4 options. So my question is, you have to answer which of the following is the structural protein of muscle cell. Which of the following is a structural protein of muscle cell? Okay, which of the following is structural protein of muscle cell? Okay, I want the answer in chat box. Do answer in the YouTube chat. Do answer in the YouTube chat. This question is very common and very important as well. Which of the following, so first there is a catch in this question, that which of the following is a structural protein? Okay, you have to answer the protein which is structural. This is the catch. Okay, and most of the people will get confused with this word structural. Okay, so actin, dystrophin, troponin, or tropomyosin. Before moving to this question, no, people are answering A, that is actin. Okay, all right, let me find. Shreya is answering A, Joyanto Kundu is answering A. Okay, actin, troponin, tropomyosin, these are something called contractile protein, because this helps, this protein help in muscle contraction. That's why it's called contractile protein. Contractile protein, this is the central concept behind this question. Contractile protein means the protein which helps in muscle contraction, like actin, troponin, and tropomyosin. But dystrophin is a protein which forms the structural framework of the muscle cell. Okay, the structural framework, I'm not going in detail right now because I have already covered that in my live class. Just to make you recall that dystrophin is something which related to the structural component of the muscle cell. That's why B will be the answer. The next question is in front of you. This question is related to the very important topic that's called hypocalcemia. Okay, as per NCERT is concerned, few concepts are very important from hypocalcemia, and the words which are very important from hypocalcemia at your level from NCERT is parathormone concept. What is the relation of parathormone and hypocalcemia? What is the relation of vitamin D and hypocalcemia? And what is the effect of hypocalcemia in body? These three informations you should know at NEET level, because these three informations are given in NCERT. Okay, so hypocalcemia leads to option A, tetany in heart muscle, option B, tetanus in skeletal muscle, option C, heart muscles cannot be tetanized, and option D, it's osteoarthritis. Okay, what is the correct answer of this question? What is the correct answer of this question? Who can tell me the answer? Who can tell me the answer? Who can tell me the answer? Option A, option B, option C, or option D? What is the correct answer? Okay, so okay, all right, listen. So I think most of you are answering. Answer for question number 2. I'm asking the question number 2. Question number 2. Do answer against question number 2. Question number 1 is over, beta. Question number 1 is done. Now you answer for question number 2. People are answering D. I guess osteoarthritis people are answering. Okay. So let me find. Or hypocalcemia, you do remember this information. Hypocalcemia, that means the lack of calcium in the blood. If you have, suppose this is the blood, in this blood you have low calcium level, definitely the muscle cell which is nearby to the blood vessels, it will also lack calcium. So in that point of time, in the muscle there is protein called actin and myosin protein which forms the complex, or that is called cross bridge. This cross bridge will not be broken if this muscle is lacking calcium. Okay, this is something fact you have to remember, and this fact is called tetany. That is the wild contractions of the muscle in deficiency of the calcium is called hypocalcemia. But there is an important story that heart muscle never tetanized. Okay, because there will be so many situations in your body you may lack calcium, and if your heart muscle your heart muscle starts doing tetany, that is wild contractions, you will be in danger. That's why there is a particular mechanism in the heart muscle through which it can bypass its tetanus in a phenomena, and that's why the correct answer is heart muscle cannot be tetanized. Okay, this is something you have to remember. Heart muscle cannot be tetanized. Now, why not the option D? Because people are answering osteoarthritis. You have to remember osteoarthritis, the one and only catchword with osteoarthritis is age. One and only catchword with osteoarthritis is age. this is the arthritis which is related only with age. If your age is very very high, then only this type of arthritis would happen in the joints. Okay, if this type of arthritis would happen in the joint, there will be wear and tear effect in the joint. That's called osteoarthritis. So osteoarthritis, it's an age related scenario, which is a degenerative disorder with age, not due to low calcium. Okay, make your concept change. Okay, so osteoarthritis is a wrong statement. It is not related, directly related, not with the hypocalcemia. And tetanus in the skeletal muscles, if I say, then skeletal hypocalcemia leads to tetanus in the skeletal muscle. Yeah, that's also true, that tetanus in the skeletal muscle is due to hypocalcemia. Okay, so you can answer both B and C. I guess now it's fine. Is it fine now? Okay. All right. So this question is a very, very important question. This question is very, very important questions. Okay. Just hold on. Is it visible? Just let me take it down once more. Just I think I'm audible. Okay. So autoimmune disorders, I think now it's fine. Yes or no? I think now it's fine. Yes or no? Listen. So Autoimmune disorder of the body include all except, okay, rheumatoid arthritis, it is autoimmune disorder, okay, and yeah, so rheumatoid arthritis, it is absolutely correct answer, it is autoimmune disorder, okay. Next, myasthenia gravis, if I say, this is again something which is called autoimmune disorder. And Graves' goiter is a thyroid disorder which is mainly hyperthyroid condition, which is also autoimmune disorder. But rheumatic fever, it's due to a bacteria, okay, this is due to a bacteria, it's not a autoimmune, and the name of the bacteria is streptococcus, okay. So this is odd. Rheumatic fever, correct answer is D. So 3 is D, because it's a disease. So rheumatic fever is different, rheumatoid arthritis is different. That is, this question is based on this concept, okay. Next question, primary curvature of the vertebral canal. 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 So I think most of you know the vertebral canal is present in this way. This is a cervical curvature, this is a thoracic curvature, then again lumbar curvature, then again sacral curvature. This is cervical curvature, this is a thoracic curvature, this is a lumbar curvature, this is a sacral curvature. So what are the primary curvature? The primary curvature are this, that is thoracic curvature is the primary curvature, because cervical curvature and the lumbar curvature, this happen later. When the baby tries to look around, then this curvature happens, and when the baby try to stand upright, then this lumbar curvature happens, okay. And initially the vertebra was like this. So if any curvature is matching with convexity, convexity outward, then that curvature is called primary curvature. Like thoracic curvature, it's a primary curvature because it is present since the birth. But the curvature which is convex forward, like cervical and the lumbar, these are called secondary curvature. So primary curvature is seen in the thoracic. Primary curvature is seen in the thoracic. That's a concept. It's a very important question. Many times this question is being repeated, okay. Okay, thoracic is the correct answer. Yes, absolutely correct. Shohili Dhara, you are correct. Ambika Das, you are correct. Anindita Chatterjee, you are correct. Sourumita Malaka, you are also correct. Deepti Pal, you are also correct. Okay, this is for question number 4. Question number 5. Odd with respect to gout. Odd with respect to gout. Now I want to tell you, whenever I am saying gout, you know, there are a few varieties or types of gout are also there. Like one is actually, whenever saying arthritis, there are different types. Whenever saying gout, definitely there is one particular reason, that is a excess urate, that is uric acid. I think you know that salt is called urate. So if you find excess urate or uric acid in the joint space, definitely that would be something called, you know, gout. Okay, now the question is why there is excess urate in the joint space. Okay, yeah, I have already mentioned in my previous class as well. In our DNA, we have something is called purine. Okay, if purine is metabolized more, it will definitely give uric acid. Okay, so purine is the correct with related to gout, because more uric acid deposited to the joint, okay, that will be known as gout. So purine is obviously related with gout. Urate crystal in the joint, straightforward description, so it is a correct statement. Allopurinol is the drug or treatment or medicine for the disease called gouty arthritis or like gout, okay, because allopurinol will decrease the productions of the urate, okay, that's why it is called the treatment. But IgM, this is not at all related with the gout, because IgM deposit, if you find IgM deposit in the joint space, that's a completely different disease. Okay, if you find IgM deposit in the joint space, That's a completely different disease, and which is called rheumatoid arthritis. Which is called rheumatoid arthritis. Which is called rheumatoid arthritis. All right, everyone. All right, everyone. All right, yes or no? Yes or no? Correct answer is D. Okay. Next question is in front of you. Which of the following muscle disorder is genetics inherited? Okay, which of the following is genetics inherited? Now you have to say which of the following is genetics inherited. Option A, muscular dystrophy. Option B, myasthenia gravis. Option C, rheumatoid arthritis. Option D, tetany of the muscle. Okay, there are four questions. There are four options against a single question. The question is, you have to say the genetics inherited muscle disorder or genetically inherited muscle disorder. Okay. So I think you know the answer already, but I want you to answer in the YouTube chat box. So muscular dystrophy if I say, myasthenia gravis if I say, rheumatoid arthritis if I say, tetany of the muscle if I say, which of the following out of these four you have to mention that this is genetics inherited. Listen, tetany of the muscle, that you already know, due to the low calcium level in the blood, obviously in the muscle as well. Rheumatoid arthritis, it's a autoimmune disorder, not a genetic related. Autoimmune, I think you know, autoimmune is something when your own body tissue and cells are recognized as non-self and your body immune system starts reacting against that. That is called autoimmune system. So it's autoimmune, not genetic. Myasthenia gravis, if I say the same story, autoimmune. But if you know the muscular dystrophy, that is called Duchenne muscular dystrophy, Pickard's muscular dystrophy, these are few names of the disorder, muscular dystrophy, where the dystrophin protein, which I have already discussed, the structural protein, not the contractile protein, is being not properly synthesized, and that's a genetically related disease. This information you will again repeat. You can repeat this information again in the chapter that is called the molecular genetics, okay, in the class 12, if you have read carefully. Why I have chosen this question? Because this is an integrated question. This is an integrated question between locomotion movement chapter of class 11, and in the class 12 there is called molecular genetics. So if you have read both of the chapter togetherly, then only you can answer this question. Okay, so this is an integrated type of question. You have to answer, you have to be very prepared for answering such questions in your actual NEET exam. Which of the following is not present in the orbit of the eye? Which of the following is not present in the orbit of the eye? So I think if you see the skeleton, if you have seen the skull bones, then you know this is something called orbit, in which our both of the eyes are staying. Okay, they have proper wall. One is called four walls. Obviously, if I consider it's an orbit, it's a wall. There is a medial wall, there's a lateral wall, upper wall, lower wall. So four walls you can see in which the eyeball will present. Now the question is that out of these four bones, three will contribute to form its wall. Okay, if I say the maxilla bone, it will form the floor of the orbit. Okay, because our maxilla is present somewhere here. Okay, so if I say about the zygomatic, it is again will form the part of floor. So it's a correct answer. If I say about the lacrimal bone, again it's correct. It is directly in contact with this wall. Okay, but if I say the nasal bone, it's wrong, because nasal bone is present towards the nose. Okay, like this. So it's not directly present forming the orbits. Now you can ask me, sir, how NCERT is concerned with this information for us? If you have seen the diagram of NCERT, in the diagram of NCERT, you can clearly see this information. Okay, in the chapter locomotion and movement, there is a diagram of skull showing the orbital bones. There it's clearly showing that nasal bone is not directly in contact with the orbit, rather it's more close to the nose, okay, nasal bones. So that's why it will be your answer, nasal bone. Next question, which of the following is called true ribs? Which of the following is called true ribs? That is something you have to answer. Which of the following is called true ribs? Which of the following is called true ribs? Which of the following is called true ribs? If they are attached to the vertebral joints, if they move with the synovial joints, if they are detached at the sternum in one end and vertebra to other end. Okay, and they attach to costochondral junction. All right. So true ribs are those. The concept of the true ribs is very nice. The concept of true ribs is, suppose I am saying this is the sternum, in front, and in the back, definitely there is some vertebra. Though I am not aligning it, though I mean they are actually present front and back, but for the drawing purpose and understanding purpose, I am drawing in this way. So if you draw it, the vertebra will start its journey from the ribs are starting its journey. True ribs are starting its journey from the vertebral end, and it is ending at this point, okay, at the sternum. In the same way, other one I am drawing, and it's ending at this point. So whenever it's a true rib, its journey will be started from the vertebral end, and it will ultimately end at sternum. Okay, that's why it's called true ribs. And in case of false ribs, the journey will start from the vertebrae. But it will not meet the sternum directly. It will meet the sternum indirectly, okay. It will first meet with another ribs, and then it will meet the sternum, okay. And if it's a false rib, it will not at all meet the sternum. That's something called floating ribs, okay. So true ribs, there is a vertebral attachment and sternal attachment both. For false rib, there is only vertebral attachment. The sternal attachment will be indirectly. So, and floating ribs is floating, not at all attached with sternum, okay. So true ribs, what is true ribs? If they are attached at the vertebral joint. So what are true ribs? Okay, again people are saying your video is lagging. Okay, so video is lagging, again saying the video is lagging. Yeah, just hold on, let me find. Okay, just hold on. Is it nice now, or till it's not visible? What do you think? Is it nice now? Or still video is lagging? What do you think? Okay, so what is true rib? If they are attached to the vertebral joints only, no, this is not the sufficient criteria. If they moves with the synovial joint, this is not also sufficient criteria. If they are detached, that should be detached. If they are detached at sternum in one end, and okay, actually this D is actually wrong. If they are attached, okay, if they are attached at sternum in one end and vertebrae in another end. This is the correct answer and complete descriptions of a true rib. Okay, if they're attached at the sternochondral costochondral junction, no, that's not correct. That's if they are attached at the costochondral junction, that's something called false rib. Okay, so again, this is the C. Okay, C is the correct answer. Okay, so how many of you have answered this question correctly? Let me find. Deepti Pala has answered this question correctly. Umbika Dash has also answered this question correctly. Next question, articular cartilage. Articular cartilage, suppose this is the bone, you know, in the bone there is a cap. Okay, at the joint, at the level of the joint, there is a cover of cartilage which is called articular cartilage, and this articular cartilage is actually present in the joint space. So now the question is how this articular cartilage is made up of. The answer is straightforward. It's a hyaline cartilage. Articular cartilage is made up of hyaline cartilage. Okay, if it is destroyed, then the replacement mechanism after the destruction will happen with the white fibrous cartilage. So there is a different thing. Okay, so right now the answer will be hyaline cartilage is the correct answer. Hyaline cartilage is the correct answer. Okay, the next question. Which of the following vertebral joint is dislocated to enclose the spinal cord in between? Okay, so okay, so is it visible for everyone? Is it visible for everyone? Is it visible for everyone? Yes or no? Which of the following vertebral joint is dislocated which of the following vertebral joint is dislocated? The concept is there's a vertebrae. If you have seen the hanging, okay, in the hanging mechanism, there is one vertebra C2 and the above it is a C1. The C1 is called the atlas and the C2 is called axis. When they dislocate, I think most of you know that at the behind the vertebral bones we have something called spinal cord. So if it dislocates in this way, like this is the axis and this is the atlas, what would happen next? That there will be impingement, or like the spinal cord will be I mean enclosed in this way. Okay, this is the spinal cord now. So this is the spinal cord. If it hanged, then it would happen like this. So the C1 C2 vertebrae, if there is a dislocations of C and C2 vertebrae, then there will be the enclosement of the spinal cord, and dislocated vertebral joint is the main reason behind it. Okay, so that is something you have to know. I think most of you also know this question as well. Okay, again lacking. Now if people are saying that it's not visible, that's why I myself has paused it. So you just let me know whether it's visible or not. Is it visible? Is it visible now? Please let me know. So what is sarcomere? Sarcomere, what is sarcomere? So if you have the idea of the muscle banding pattern, this is the muscle, you know already. This is the two. Here I have drawn the sarcolemma, that is the muscle cell membrane, and you know this is the actin. I'm drawing in red color right now. Okay, and you know this is the myosin, which is thicker, and I'm drawing in this way. Okay, so this is called thick filament as well. The sky colored component is actually the myosin, which is actually thick and thicker. It's called dark band as well. And to say you, this is, you know, this is something is called E band, which is made up of thin component, that is actin, and this is called the I band. Sorry, this is called I band isotropic, which is made up of the actin component, and this is called the A band, which is made up of the thick component, that's the myosin component. Okay, so you have to know the what is the sarcomere. Sarcomere, for knowing the sarcomere, you have to know what is the Z line. Z line is the middle of the I band. This is something called Z line, and in between this two Z line, this is something called sarcomere. Okay, so the correct answer is D. That is, the sarcomere is the distance between two Z lines. Okay, this is the part between two Z lines is the correct answer. Part between two Z lines are correct answer. Everyone is saying it's hanging. Is it visible? Is it visible? Am I audible? I think now it's visible to everyone. Okay, the next question is on the screen. Which of the following is involved? Which of the following are involved in the muscle contraction? Which of the following are involved in the muscle contraction? That's the question. So you have to say it. Which of the following are involved in the muscle contraction? The ions are mentioned in pairs. So like calcium, magnesium, calcium, sodium, sodium, magnesium, and magnesium, potassium. This is a previous year question. So people are confused in between calcium and magnesium and calcium and sodium. So some are saying that this is like the neuron if I consider, and if this is the my muscle, so you know that the sodium will depolarize the muscle neuromuscular junction. So we can also consider sodium. And you know, like as this is the actin and this is the myosin, for this also you know something is there which is called C-troponin, which is actually part of actin. So and which helps in cross bridge formation. So calcium is also required. But I would say this sodium is, but you cannot, there is another option which is very controversial here, magnesium, because we also directly require magnesium at the head of myosin. So magnesium and calcium is directly related even in the muscle contractions, but sodium is something, this event is which is very earlier with comparison to the incident which is happening with the help of magnesium. So we would go with the answer sodium, and we would go with the answer calcium and magnesium. Okay, this is a better answer. So calcium and magnesium is better answer. Okay, it's better answer than calcium and sodium. So go with this answer, calcium and magnesium. Go with this answer, calcium and magnesium. It's better answer. Calcium and magnesium is the better answer. All right. Next question. Which of the following joint is found between the sternum and the ribs of human being? Okay. Which of the following joint is which of the following joint is found in between sternum and ribs of human being? If I say this is the sternum, if I say this is the ribs, which type of joint it is? Is it angular joint? Absolutely no. Is it fibrous joint? Absolutely no. Is it gliding joint? Absolutely no. It's a cartilage actually. It's actually cartilaginous joint. The correct answer is cartilaginous joint. Okay, now the question is which of the which one yield ATP? Which one yields ATP required for muscle contractions? Okay, so creatine phosphate, creatinine phosphate, myoglobin and myosin. Which one is required for the ATP generation? Okay, myosin and myoglobin. The myosin is actually contractile protein. Myoglobin is the oxygen carrier, so not at all related to the ATP production. So I think you are confused with creatine phosphate or creatinine phosphate. Okay, creatine phosphate or creatinine phosphate. So the correct answer will be creatine phosphate. Creatine phosphate, this donates a phosphate, and that phosphate is captured by ADP and ultimately will form ATP. So correct answer is creatine phosphate. Next question is elbow joint. Elbow joint is ball and socket joint, hinge joint, suture joint and gliding joint. So if you know the formations of the elbow joint, this is the head of humerus. Okay, and you know there are two type of bones. Okay, one is radius bone and this is ulna bone. Okay, so this joint right now I'm mentioning as elbow joint is actually, it's a hinge joint. It's actually hinge joint because the funda of a hinge joint is that this is the hinge. This can open maximum up to this, but this cannot go like this. Okay, this can happen, but this cannot. So hinge joint is somewhere it will be restricted. Okay, like I can extend my elbow up to this, not beyond it. Okay, so this is the hinge joint is the correct answer. All right, the next one, see question number 16. Sutures are present between various bones of skull. If you have seen the skull bone, you will get it better. If you have seen the skull bone from side, you have seen multiple lines like this. Okay, this is the frontal bone, this is the parietal bone. Okay, you know this is the temporal bone. Okay, you know this is the occipital bone. So the question is, these are called sutures. So how the sutures are, actually what type of things are present in the sutures? They are nothing but only presence of the collagen fiber. So these are called fibrous joints.